Hello.
Hello.
How's it going?
Good. I'm a little bit nervous. Dr. Laura just told me immediately before starting record that she has intro articles that she doesn't want to tell me about, which means
I just want your
she wants my gut reaction, which is so sketchy.
I want your how do you feel about it right now, right here. Okay. So article posted April 24th, 2024. Canadians are more likely to eat food past best before dates. What are the risks?
First of all, Canadians compared to who?
I don't know. Okay, hold on. Okay.
Well, I mean, for anybody that's met me for 16 seconds, yeah, I'm going to eat expired food. I mean, I stratify it in my own mind in terms of like what's likely going to kill me. Like, will I eat expired pork? Probably not. Now if there's a like sealed cottage cheese or something that's never been opened, I'll probably go for it.
No. Okay. I'm a really big okay. First and foremost, if you missed our previous episode, we were talking about this exactly. And how Food Basics was trying to scam me out of my personal hard-earned money and trying to get me to scammingly buy a hummus that was expired. Okay. First of all, robbery. Second of all, if they want to give it for free, I'm cool with that. There are certain things that I will actually eat. If they were like, listen, we're giving these hummus for free. They expired 3 days ago. It's sealed. What do you think? I'd take it for sure.
For free.
Yeah.
And then for the record, for those who missed the last episode, first of all, just go back and listen to it because it was a banger. Second of all, Ashley told Laura to go shop at Food Basics. So I've probably been, just buying expired stuff.
Yeah.
On the regular.
Do you know what's crazy though? Like dairy, for some reason, dairy's been, I think I need a new fridge. Dairy's been expiring in my fridge. Like I had a container of ricotta and I opened it.
That is not how I say ricotta, in case you're wondering.
You say ricotta? It's
ricotta.
Ricotta.
You only say that because your husband's name is Luciano.
Yeah. No, I have to say it like that. I can't come to family gatherings.
No, you can't. No, you can't. I've met his family. No, you can't.
It's just ricotta. Anyways, I had that cheese in my fridge and it smelled like penicillin. Okay.
That is, so you shouldn't eat that in case everybody's looking for my global advice. If it smells like penicillin or tastes like a penny, you got to throw it out.
Okay. So you can tell that food inflation really has pushed Canadians to think differently about food.
Right.
But this is actually like a problem. But here's the guidelines if you want to eat expired food. Foods like bread, meat, milk, cheese fall more into the category of being able to eat, but must be done so with caution. Seafood, deli meats, and even leftovers after 5 days should be avoided.
Okay.
So, again, when we get to the point of turning to the spoilage, rancid odors, and visual, that's telling you something really isn't worth taking the risks.
Yeah, we do the sniff test in my house. You just you give it a sniff, and if it smells real bad, you don't eat it. Or if it's like visibly growing things, then like pass. But on the most part, I'm just eating it.
Second article that I'm jump scaring Dr. Ashley with.
Well,
solar eclipse eye damage. More than 160 cases reported in Ontario and Quebec.
Shocked. Just shocked. It's because of all those fake glasses.
And people who just
we called this, to be honest. If they had listened to Health and Her, they would have known.
They would have known that they weren't supposed to look at the sun. Like, you know who did it?
It's the people trust the glasses from the Toronto Library.
that they could have got for free.
Yeah, for free.
And you know what? To me, this is like a bit of karma, ? Because like, these are the people that are like, it's fine. Everything's fine. I'm going to look at it. It's not a big deal.
Right. Enjoy your retinal damage forever.
Eye damage. Yeah. So that was a thing. Okay.
We totally called this. What a full circle moment.
What a full circle moment. And these are things that we've talked about before. So I wanted to bring it back. But what I do want to talk about is I've had the worst pain in my neck for like 2 weeks now. It's caused headaches. It's caused like I've been seeing massage, physio, like all the things.
Only knew a chiropractor.
We're not going to talk about all the logistics as to what is going on right now. But I digress. I've had really bad neck pain, and I find that every time. So for me, I live my life like this. If you're watching video, my shoulders
Right.
are earrings, as Ashley would put it, and I need to like bring it down. But I hold all of the tension in my neck, my upper back, my shoulders, and so I go through waves where I will be really, really tense, headachy. Then I'll get it fixed. Usually I see Ashley for treatment and then it's like all good. And then I go in another wave and then I go in another wave. And when you're in a spot like me, where the past 2 weeks I've had to take Advil every single day and I hate taking it, but sometimes you get to the point where you need to take the edge off. And like, that's where I'm at. And when you are in these kind of scenarios, it really makes you value health in general. It makes you realize that without your health, you truly have nothing. Think about the last time you had a cold and you've never valued breathing out of your nose more. And so I just want to start this conversation with saying that because I think it's a huge thing that we don't realize. We're so quick to brush things off until they get so bad that we have no other choice but to pay attention to them and listen up. And I think I really want to talk about the cost of healthcare today.
Yeah, I think this is such a good and loaded topic. I think there's so many angles to this.
Yeah. So I wanted to get started with the things that, I value or the places I, invest my money. And I think it's interesting because when you look, everyone has different priorities. And I find that now there are circumstances where people genuinely don't have money. They do not have the funds. They cannot make it, day to day, month to month. Like this is not what I'm talking about right now, because there are a lot of cases like that. And I think when it comes to healthcare and alternative care, we're in a good position where we can spend more time with patients. We can, offer supports that maybe the Canadian healthcare system or Ontario healthcare system really can't handle right now. So we do have that benefit. But the con is that we don't get paid unless we are paid by a patient. So we don't get, salary jobs. We don't get paid if we're not seeing people. And we pay a lot of overhead and all these things. And we've talked about this before. So I'm not going to harp on about that. But I think that when we're trying to reach people, this is why we do the podcast. This is why we do, free workshops. This is why I do my free Hormone Society communities, because we're trying to reach those people who maybe cannot afford our services, cannot,
like we want to be accessible in the ways that we can while still paying our bills.
Totally. And the reality of healthcare is that one-to-one care is not it is an expensive thing. It truly is. For us, for a patient, it is an expensive interaction for the amount of overhead. So this is why we do a lot of all of these free things, these resources, to hopefully help you in some way, shape, or form, to help you, piece together things if one-to-one is not an option for you. But that's not what I'm talking about right now. Right now, I'm talking about valuing and prioritizing. Because I find it interesting, looking at, and not in a judging way, but just in an observant way, looking at how people spend their money. And I know, Ashley, you were talking about a gym membership. We were chatting.
Yeah. So I'm going to chat a little bit about this because I think that there's always more than one side to the coin, right? So oftentimes when I'm counseling patients around physical activity, and beyond the, first step is why should you be active? What are the benefits? And then from there, how do we practically integrate this into your life in a way that's accessible? And a lot of people that I work with is a lot of women that have young children, and they're like, well, I feel the need that I need to leave the house to get away from my womb gremlins in order to be able to exercise for myself. Okay, great. Let's talk about that, right?
Yeah.
And we get to the breakdown of costs. And a lot of people will say, okay, I'm going to go to Fit for Less. And if you are not a Canadian listener or you don't have one in your city, there's nothing wrong with this gym. It is a very simple gym. It's very, very low cost. I wouldn't be able to tell you the dollar value, but for sure under like $30 a month, right?
Yeah.
And or I'll have arguments with patients that say like, oh, I have a gym membership. I'm not going to do anything more guided, right? And I'll say, okay, like, so you pay, your $30, $40 a month.
Yeah.
How often do you go to the gym? well, I haven't gone in the last 6 months. I'm like, okay.
Yeah.
How's your training going? Well, like it's not because I'm not going to the gym. I'm like, okay, makes sense. So now we have to have the discussion of, is that wise spending? Would it make more sense, let's say, to invest in, I don't know, a set of dumbbells, a stability ball, a step, some bands at home? Well, I don't want to output that money. I'm like, but you've been putting out $40 a month and throwing it around to do nothing, right?
Yeah.
Now for those that don't know me, I myself pay and work out in a small group training facility. So like a boutique gym, if you will, classes. So there's like a central, the programming is done for you. There is always a coach in the gym to go through all the movements with you, watch your form, things like that, motivate you. And it's capped at 10 people. Now I pay well over $100 a month for that membership.
Can we pause?
Yeah.
Can we pause at that over $100 a month? Because I just want people to understand that Dr. Ashley is also a single mom. Okay, we're not like, oh, Ashley pays $100 a month or over $100 a month, and she's got like this wealthy husband that pays her bills and
right. No, there's none of that. There's none of that.
Yeah.
So correct. I don't have, like this exorbitant budget to work with, but I do. I pay over $100 a month for this membership. To have access to a coach, to have somebody watch me do the movements appropriately, because although I know what I know, it's really hard to, watch yourself in a gym that doesn't have any mirrors because the vibration will shatter the mirrors, right? And and there's accountability to it because you're paying a certain dollar value. You actually have to check into the class too. So you book the class in advance, and there's an option where you say, use my gym membership to pay for this class. And then you go on like an attendance list, and then you show up to this class and they like check you in type thing. Right.
Mm-hmm.
So, I pay this for a gym membership for the community, for the accountability. And so that I'll actually goddamn go, right? Because it takes a lot off my plate. Can I program for myself in a gym? You betcha. I do it for a living. Do I want to? Am I going to? Am I going to do that? So what's it worth to you, right? I utilize my gym membership. Those that are spending, 30, 40, but $60 a month and aren't using it, you're not really getting the progress you're looking for. You're probably better off to pay for a coach. Or none, right?
Mm-hmm. Yeah, absolutely. And that's the difference, right? It's like, what are you valuing? What are you prioritizing? Because I know you don't spend on certain things so that you can spend on your gym membership. For me, I don't spend on certain things because I value now. I don't pay for a gym membership. I pay for an online fitness thing that I do. And do I do it consistently? No. But I also prioritize my supplements. I prioritize, getting blood work. I prioritize testing I need. I prioritize, those sorts of things, health related things I will invest in all the time because of, what I do. And, there's nothing wrong with investing with something that just like feeds your soul, right? Like if you want to do, like, you have a tattoo.
Yes, I do. A pretty large one.
And investing in that's an investment, but that feeds your soul. And there's nothing wrong with doing something like that. I think we all just need to be aware of the type of spending that we're doing, the type of investments that we're doing, and the real reason why we might choose one thing over another. Now, one thing I thought was interesting is I wanted to figure out how much Canadians were paying out of pocket for healthcare expenses in Canada. Now, this came from, it's a statistics website. I don't know if it's not StatCan, but it's an official statistics website. And so the per capita out of pocket healthcare expenses in Canada in 2021, I think you've seen the graph, but take a guess. If you were to say per person, an average amount that they paid out of pocket.
In Canada?
Yeah.
Or in the US?
Oh, Canada. God,
no. Canadians are cheap with our healthcare system. I actually haven't looked at the graph. I don't know, $5,000.
$959.40.
Come on.
Yeah.
That's crazy. How do you even go to the dentist for that?
That's in 2021. Do you want to know how much the per capita alcohol sales were that same year? Per capita.
Probably double that. I don't know, $2,000.
You're highballing here. So 2021, the sales value. Sorry?
So maybe I just drink more than most. No, I'm kidding. I
Right.
don't spend that much.
So the sales value of alcoholic beverages per capita in Canada, I'll do the same year, 2021, $798.40. So people spent out of pocket for healthcare, 959, and that is including. I think that's I was trying to find, sorry, what that included.
Right.
I'm gonna go hedge a bet and say that's also like dental. That's like I want to say that's like medications that are not covered potentially. I want to
Right.
say that's a number of things. So that's not like someone seeing a naturopath. That's not someone seeing a chiropractor. That's like total everything in a year.
That's
Um,
crazy.
it's like not a lot at all.
No.
And they're spending the same, if we're looking at the same, like apples to apples, the per capita for 2021 on alcohol was 798. That's just alcohol. The health spending out of pocket is not just naturopath, just chiro, just gym membership. It's health spending. And this is just alcohol. So can we put that into perspective?
That's awful.
So people are spending, again, we don't blink. And again, I also drink. I'm not saying I'm holier than thou. I'm not like, we don't drink and we do, like we do
No,
drink.
we do.
What we're trying to talk about here is pointing out the obvious things. I have patients who smoke. Do you know how expensive
the
smoking
cost
is?
of smoking. You know what? I used to, one of my many lifetimes ago, I worked for the Sobeys Corporation. I used to sell those cartons of cigarette. And I think the cartons way back then were like $40 or something like that.
Yeah.
I can only imagine what they cost now, but smoking is just like for a cost alone, not even talking about like the effects on your health. It is pure insanity.
Yeah. And I actually went through it with a patient because I said, what would it, because she had said, I can't afford to buy the supplements this month. And I said, how much does it cost you to smoke? And she said we worked it out. It's like over $400 a month.
Nuts.
So I think,
and I mean, there's other frivolous spending as well. Like this is at least somewhat comparable, but again, it's hard for us to not notice. And again, it's not judgment. This goes back to whatever lights your soul. Like I know people that go get their nails done every 2 weeks.
Yep.
I know a lot of people that go get Botox quarterly, right?
Yep.
And again, I'm not judging you. You
Yep.
get it. If it makes you feel good, okay. But like, it's not even questioned, right? They just do it.
Yeah, absolutely. And they don't even, and it's one thing, again, if you do it and you're looking at other things, but think about how much the Taylor Swift tickets were. I don't know if you were like part of that news cycle, but they were like about $1,000 plus to go to a concert. And now I'm a Swiftie. I love Taylor Swift, but
couldn't care less.
I would. Okay, so think about someone who you love. Would you pay $1,000 to go see them?
No, I just don't value that experience enough. I just don't.
I don't either. And I think, and there are people, again, what lights your soul on fire, right?
Yeah.
If that's what lights you up, if, I know people who do, my mother-in-law makes, she does what's it called? Clay, like making bowls and mugs.
Okay, like pottery.
Yes, pottery. I'm like, why can't I think of the word? So she does pottery. She said it's a very expensive hobby because all the supplies and all the things, like to do a class, it's not cheap, right?
Right.
Something like horseback riding, not cheap.
Oh my gosh, horses, crazy.
Yeah. So again, what lights you up?
You know what? I dump a lot of money into sports and sports gears, right?
Yep. Yeah.
Go buy a baseball bat. Like you can easily blow $300 on a cool bat, right?
Totally. You can spend money anywhere. And I think, having hobbies is part of being a happy, well-adjusted human and doing things that you love, whether it's pottery, whether it's going to concerts, whether it's playing an instrument. Certain instruments are more expensive than others. Certain sports are more expensive than others. Like my brother played rep hockey. That was a lot more expensive than rep soccer was.
Sure was.
So I think it's important to look at all of those things. We're not sitting here saying you have to spend money on healthcare and sit at home and eat ramen. That's also not healthy, right? But what we're saying here is let's really step back and look at, maybe we don't go see someone one-on-one. Maybe we don't go get the personal training or the customized exercise. But what we do is we don't spend 700 and whatever on alcohol.
Or maybe you consider painting your nails at home. I don't know, man.
Yeah. Like, I haven't got my nails done in like over 4 years. So I can't really speak to this because it's just not something I value. I don't care about it. I don't look at it. I probably could stand to use a manicure. I don't know. I just don't care.
Yeah,
To
totally.
me, I'd rather, invest in something that's going to help me live longer. And like I said, when you're sick, there's nothing you can think about more. How can you go to that concert if you have crippling back pain and you can't move?
Yeah, no, I agree with all of this. And it's just a conversation too. Obviously, it's a little bit different for us because we work in sort of the privatized sector of the healthcare system, right? So sometimes the conversation of cost does come up because we're not like an OHIP covered service and people do have to pay for us either out of their pocket or extended healthcare benefits. And as a result of that almost that justification or trying to at least put this into perspective for people, that's where it kind of comes out for us as well, right?
Yeah, exactly. The last thing is most of the budgets that I was looking at online when like, how do Canadians spend their money? First of all, if we're actually looking at, US versus Canada, I wanted to look at like the cost of care. The healthcare system in the United States is actually more expensive than our healthcare system here. If you've ever gotten care in the States, which I haven't, but I have many patients who have, and it is just a higher quality. I just will say that.
Right.
But the average health expenditures in the United States average out about 12,914 per person, nearly double the 6,500 spent per person in Canada. And that's like government funded and or in their case, that's not government funded, but
Right.
here it's taxpayer funded. I say government like somebody's handing us something. We pay a lot of taxes.
A lot of taxes.
So just to put that into perspective, I think that people in the States look at healthcare a lot differently because they're actually given a bill for everything. They can actually see what something cost. So they're able to, have perspective. I remember, growing up, my mom, we were always under my mom's benefits. My mom always had fantastic benefits. And I was, a little brat that thought everything was free. I thought everything was free.
Well, I don't even know that makes you a brat. I think that's how a lot of Canadians are raised, right? Like we're not given, I think it was you that brought it up actually. I think this is a really fantastic learning point is I think it would be good to be handed a bill of how much your services cost. And then obviously, covered by OHIP, right? So we can see that, but I think it's really valuable to know how much that visit with your family doctor costs, right?
Yeah.
The only thing that gives us some perspective with this, and I always have to hide rolling my eyes when I talk to patients about this because they'll come in and they'll know that I'm a dog person and that I foster, and they'll kind of rag on vets and they'll be like, you wouldn't believe what they charged me. And when they tell me the cost, I was like, that seems cheap, actually. Like that's a doctor and you're griping about, $120 exam. Like I don't think they're paying their bills off of that, to be perfectly frank.
Well,
or an X-ray series. They're like, did you know that his X-rays cost, $300? I'm like, I do. In fact, that is how much, a series of X-rays costs. And say an MRI, you're guaranteed $1,000. Like that is the cost of it, but we don't pay it. So people don't appreciate that that's truly what that service costs.
Well, and also it's interesting because because of you, I follow a lot of the rescue, agencies and groups. And, one of the ones I follow, they post about, donating because they have a running vet bill that is not able to be paid because they take donations. They're a charity. They're an organization that cannot, foot the bill a lot of the time. And then it made me think, wow, these vets are actually doing free work.
Vets are, on the most part, the most empathetic, poorly paid doctors I have ever met in my life. Honestly, most that I've met are total gems. And what I like about some of these organizations is they break down. I know Precious Paws, whom I foster for, they when it comes to their adoption fees, they break down like what each animal has had and what they've had to do and the cost of that, just so that people understand, these adoption fees are not just like made up, right?
Yeah.
And I think that, for a regular human, that would allow them to see where it is their money's going, right?
Yeah, and I think it's really important to understand that. And I think also when you pay for something, you value it more inherently. And I think when we look at paying for healthcare, I think that's a lot of the place where we go wrong. Like you and I both, I do a lot for free, like a lot. I hop on live, I do education, I answer questions. We do this podcast, I send an email, I have a group, I do workshops. Like I do a lot for free.
For sure.
In the hopes of educating the community and helping people understand that they have options when it comes to their healthcare. And I know you do a lot of that too. You donate your time to organizations. Like there's a lot of different things that go on behind the scenes. I have worked with patients one-to-one, and I actually for free, and I actually used to do a free grant where I would offer it. I'd say, listen, you apply, I pick you out of a hat, as long as you are willing to commit your time. And or if we do any blood work, that's an out of pocket, or you ask your doctor to do it.
Right. But very minimal expenses.
Right. Maybe that's $150 to work with me for 6 months and get all the guided support, unlimited follow-ups, etc. Do you want to know that I stopped doing it because the people that were doing it, that had applied, and again, this has happened more than once, did not care, did not follow up, did not do what I said, did not follow the plan. And I knew that I could get them good outcomes, but you pay to play. I find when you don't invest your money.
And it's so frustrating for anybody listening. This is the most frustrating thing as a practitioner, when you know that you can help that person and they can accomplish their goals if they just do it.
They just do it. Yeah.
If they just do it. It's so frustrating.
Very frustrating. And I think that's what it comes back to is it's the priorities. It brings me back every single time. It's the priorities. And it's hard to change. I totally get it. And you know what? I find you and I are quite reasonable with the changes that we recommend. We don't make people like drop their whole life and everything else. And when we look at when we look at spending with Canadians, we see that the highest spending, no surprise, comes to food, housing, and transportation.
Yep.
Do you want to know? And inflation is a thing, and food is not cheap. But do you want to know that Canadians spent 39% of their food budgets at restaurants from January to March? This was an article that said Canadians are back out dining, with restaurant spending reaching pre-COVID levels. And so
interesting, giving like the house of cost. Sorry, oh my God, the cost of housing and all the other things. Wow.
Yeah. People are spending 39% of their food budget at restaurants. So I love that for the restaurant industry. That's great.
I do. I was going to say, I have mixed feelings on that, because I know some of the most lovely people in this region that have restaurants and bistros, and they're such incredible business owners, and they offer something so great. So I don't ever want to see those people go out of business.
No, and we need to contribute to the economy at large.
Yes,
right?
yes.
But I think this conversation really goes back to, you're spending 39% of your food budget at restaurants, which obviously it costs more to eat at a restaurant than to buy your own damn food and cook it at home. But if you're also struggling with chronic pain, weight loss issues, diabetes, heart disease, high blood pressure, like something's got to give, right?
Correct. Yeah.
And I'd prefer it be the no, I don't prefer it be anything. You choose what it is. You choose what gets to go, right? But something's got to go. And you don't have to see me. You don't have to see Ashley. My point is that you need to invest in something for yourself, because if you don't have health, you have nothing. And and Ashley and I will harp on this again and again, working on the foundations: sleep, movement, water, fiber, protein, breathing, stretching,
stress management,
right? And so, no, you don't need to see the naturopath and invest in the things, or see the chiropractor and invest in the things. But I think if you want to prioritize that, if you want to prioritize your health, figure out what you need, right? Figure out what you do need to invest in. But it can't be nothing, right? Maybe
Yeah.
you're investing, and the I don't have time people. How are we going to create time?
Yeah.
How are we creating time? Because you can create time in your day. You can shift things around and prioritize your walking pad versus your
Yep.
television show.
And that's the thing, right? It's a sliding scale. And I have this conversation. I had a conversation with this patient today, about managing expectations and not being able to do it all. This individual owns her own business, works in it full time, is gutting and renovating a house, and is home 60% of the time with her son.
Yeah.
So, and can't figure out why she has neck pain and or wrist pain. And I said, well, I can tell you for free why. And I understand that these things have to happen, but as your stress levels, or as your pain increases, so does your self-care strategies, right?
Yep.
Like we need to find a way to manage these things.
Yeah, and something's got to give, right? So,
Yeah, you can't do it all.
Yeah. So we have to prioritize. Hopefully, this conversation gave everybody some food for thought. We
Yeah.
just thought it was a conversation that should be had, and something that maybe will create a little bit of perspective for everyone. So a little bit different than our usual, but I thought it was a fun topic to have.
Me too.
All right. Well, we will see you guys next time.
Thanks for listening, folks.
Bye.